Assalamualaikum warahmatullahi wabarakatuh, and good morning everyone, and good day. It depends when you open this video. Alright, so we meet again. My name is Ikmal. So this time I would say that Gout part 2. Okay, we're going to talk about gout, and most of the information I got it from these two references from Andres and Joseph's. Okay, based on their information I put it on here to give a brief regarding this particular process. Okay, so for today's topic we will focus on gout etiology, the process how it develops. First, better we go for the definition as just mentioned in the previous video. Gout is a syndrome that caused by the inflammatory response, okay, to tissue deposition of monosodium urate crystal, and later on we go for MSU. Okay, so you feel the inflammation, the pain, and so on. Okay, mainly the inflammation, redness and hotness is due to the effect of inflammation by our own immune system try to solve the issue of the deposition of the MSU. Alright, and for your information, this particular gout is actually been observed since 2640 BC, okay, before Christ, okay, or century, in which is the first identified by Egyptian, okay, in a way, and then in the 5th century BC, Hippocrates refer to the gout as unwalkable disease, and they already managed to link that gout is related with lifestyle, demography, and other variables. Okay, so we do know that they have several variables, but the most cases that we have is mainly due to dietary. Okay, then it does not minus or does not did not acknowledge other reason or causes for the gout. Okay, because we might have due to the genetics, okay, overproduction or under secretion and so on. All right, so we go for the next slide. Is regarding still under the etiology of the gout. Okay, it's actually a very common for the one who have gout have hyperuricemia, which means you have a lot of uric acids, okay, in the body. This is hyperuricemia in the gout, in which during this condition, 2/3 of the uric acid is usually, alright, excreted via the kidney, okay, and 1/3 is through our gastrointestinal tract. That one will be using our feces. Alright, so 90% of the cases gout are secondary to under excretion, which means that it should be removed out, but somehow your body or our body unable to remove it immediately through 2/3 is urination. And the overproduction is a secondary to defects in the hypoxanthine guanine phosphoryribose, which is HGPRT, or due to phosphoryribosyl pyrophosphates. Okay, so this is a few compound that help to balance or to excrete out uric acid. Before that, let me change my cursors. Alright, okay, so based on the US data, alright, a major musculoskeletal disorder in US, okay, the fourth highest, alright, and this is expected to have occurred in 2025, okay, is considered by gout, which is 2.6 million in 2005, and it is projected to increase to 3.6 million, okay, another 3 years from now. Alright, so it's a second after osteoporosis, alright, and third after osteoarthritis. Okay, this is among a major issue, okay, for musculoskeletal disease. Right, so this is the overview of the process or the etiology. Okay, and you can see the diagram here. I need to change this. I cannot move the screen. Later I will move it. All right, so as mentioned before, gout is due to several factors. All right, So one of the factors mentioned here, we categorize it in various risk factors such as under excretion and overproduction of uric acid, and then due to hyperuricemia, and hyperuricemia also included under asymptomatic and symptomatic states, okay, which is uric crystal formation and deposition, activation of monocyte and macrophage, release of a lot of our cytokines such as interleukin 6, 7, and tumor necrosis factor alpha, this contributing to the gout process, release of inflammatory mediator. This is, you get the bulk, okay, a typhi we'll call it, okay. It's a hot red situation, inflamed on that particular area, okay, not this particular joint, you know, it's mainly focused on our feet. Okay, for the symptomatic disease with complication, usually this is for the acidic environment and more deposition of uric crystal. Right, so the disease progression is start like the first phase, okay. This is within the leg, okay, and then the more crystal MSU deposited in the stage 2, and it's become bigger, and it become like hindering the movement of that particular joint on the subvenal joints, okay, subvenal region. So this is already full-fledged gout attack, and it's very and extremely painful. Okay, so this is the overall what we're going to look on the etiology later on. Okay, usually overproduction is already overproduction. The cost is up to 10%. So which means that you produce uric acid. But the most cases is due to under excretion. Okay, that cause the deposition of the the crystal. Right. So one of the main reasons is you take a high dietary of purine such as meat, seafood, and beers. Okay, beers. Meat is something like pork, beef, lamb. Okay, internal organ of chicken, a cow, or anything else that is rich in purine. Seafood, shrimp, tuna, and so on. Okay, this is due to the dietary. All right, and that cause overproduction. And even though it not an overproduction, it can be under excretion, can also cause a gout as mentioned here. Okay, endogenous purine synthesis based on the own body. Okay, if someone is already in malignancy, have malignancy, okay, this is due to the death of the cell, okay, and they produce a lot of, in the sense they produce a lot of purine. Okay, beside that, purine salvage of HGR, PRP deficiency, and PRPS as I mentioned before, and purine breakdown due to glycogen storage diseases. Okay, all of these can cause hyperuricemia, in which they should be normally under GIT excretion and through our urination. Right, for the urinary excretion, if you have the diuretic and renal failure, this is one of the main reason for under excretion and urinary reabsorption through alcohol and genetic defects. Okay, it should be flushed out but reabsorbed into the body. Alright, the main risk factors here is a male. Okay, you can see that female is not under the risk factors, age, and if you're obese. Okay, age generally for 40 years old, and that's we discuss on the reason why a female better compared to male in terms of the gout is due to the estrogen hormone. Okay, so when the crystal already deposited, okay, in the subvenal joints, okay, what happens is that our cell release a lot of inflammations signs, okay, and which is will attract our leukocyte into the site, and that is what cause acute gout, and most likely secondary to the formation of a new crystal. Okay, and so a lot of leukocyte come in and try to solve it, but you know that is crystal that cannot be break down by lymphocyte or monocyte or phagocyte or anything. Okay, so they just came there, they can increase a lot of pain, okay, and it become inflammation on that particular area. Alright, factors that precipitate gout include such as if the person underwent for surgery, trauma, alcohol, starvation, and even on medication. So this is the region, what we call it tophy. Okay, this is the deposition, and this is the savanna region, uric acid accumulation on here, right? I personally have experienced it, extremely painful. Okay, even a minute vibration is something like you want to scream. It's so painful. All right, the most frequent site of deposition of MSU crystal are in the cartilage, epiphyseal bone, and periarticular structures, and within the kidney. Okay, so a topos, which is a singular, when if the plural we call it a tophy, this one. Okay, happen when a crystal of the compound known as sodium urate monohydrate or uric acid build up in the particular area. Okay, in the kidney of the position of MCU, crystals are interstitial, within interstitial fibrosis and arteriosclerosis. Okay, sorry, sclerosis. Okay, this is the area where it's developed. Okay, so epidemiology regarding these cases is quite prevalent as asymptomatic hyperuricemia is about 5 to 8%. The prevalence of gout is usually 13 cases per 1,000 men compared to 6.4 cases for women. And the higher uric acid is the higher risk for developed gout. So higher uric acid, one of it is you go for the diet, okay? Then that is among the reason why you get that. And for my cases, I mentioned you before that one due to high intake of meat before that, before the night before. Then the next morning I found out I having gout. 90% of patients with primary gout are men. Okay, that's why it's for me personally seldom for me to heard women have gout. Okay, especially for those who are below 40. Right, I heard that one of like a grandma get it, but that her age is already 80 to 90. Okay, so apparently women are really develop gout. This is because before menopause, okay, because the estrogen are thought to be uricosuric agents, okay, which is the help to remove of the uric acid. Peak incident in men is in the 5th decade, and for me personally, I having that in my early 30s. Okay, primary gout is associated with obesity, hyperlipidemia, if you have diabetes mellitus, hypertension, or osteosclerosis, just like we mentioned before. Okay, so the cause of secondary gout, okay, usually include excessive dietary purine intake in case of nucleotide turnover. For examples that you eat a lot of shellfish, organ meat, alcohol beverage, and soft drink. So if you are having this particular condition, okay, try to reduce this one. Okay, although I would say that the best is you go pharmacy to get the drugs to release the symptom immediately, alright, or gradually. And this is a thing that if you already have experience having gout, so better you carefully take this and drink a lot of water to help a lot of urination process. Okay, that's all for this one. So for the clinical manifestation, we go for the next slide. Okay, right. Sorry, the next part, which is the part 3. All right, thank you everyone, and have a nice day.